I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video on keratoconus and headache. If you suffer keratoconus, it's possible that the headaches you might be experiencing are associated with the keratoconus and not anything else. Now please be aware, headaches are very serious, get investigated, but if it all comes back negative and you still have headaches, then you may want to think about whether the headaches are due to your keratoconus. And why do I say that? Well, it's not typically taught that keratoconus is associated with headaches. But keratoconus is an optical distortion of the front of the eye. And if you want to know what that means, just go into any very bright light, glary light scene, whether it's a disco or whatever, and you'll find yourself straining and you'll get a headache. That's very common. The eye is an optical device, plus it's the most sensitive tissue in your body, and there's many different reasons why that will trigger a headache. So a headache is what we would call a secondary presentation of keratoconus, the primary being, of course, vision loss. So it struck me when I would operate on these patients that they would turn around and go, "My headaches are gone, doc." And I initially said, "Oh, come on, what are you talking about?" But after a couple of people tell you, you start to think about it and go, well, actually this is very interesting. And I do explain to patients that I hope to improve their vision, and the headache resolution would be a secondary benefit. Can't promise it, but it might be. So if you're experiencing these sorts of headaches and you've got keratoconus, what can you do? Well, you can do a couple of things. Firstly, if you put contact lenses on, you should get a reduction in your keratoconus headache. If you wear your full spectacle correction for your near vision work, most of us are around computers, it should reduce it. Outdoors, sunglasses will help. And they're your major ways of doing it. The other way you do is just change your monitor over to a reduced illumination night vision type. My laptop is always on a night light setting rather than the full exposure to reduce the amount of glare and the distraction that you get. So you can try all of those things to ameliorate your headache, but it may not work and you might need to go to surgery. Surgery is an option for headache, but I would only do it if you go to vision improvement. I wouldn't offer you surgery if you just simply had headache. I haven't noticed patients to say their headache has improved after laser vision correction with keratoconus, but it is possible. So that's keratoconus and headache. It's very, very real. If you suffer it, think about it, but make sure there's no other cause of your headache. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and thanks for watching.